Just ahead on American Black Journal, the president of University of Detroit Mercy is here to talk about the changes taking place on his campus and how the college is investing in Detroit's future. Plus, black healthcare administrators from across the country just wrapped up their conference in Detroit. We'll check up on the condition of healthcare for minorities. Stay with us.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.
Welcome to American Black Journal. I'm Stephen Henderson. University of Detroit Mercy is an urban institution committed to engaging with the community and participating in the rebirth of the city. The school is collaborating on a number of initiatives to help strengthen neighborhoods and attract businesses to the area surrounding its campus at Livernois and McNichols. One of the projects involves the improvement of medians, sidewalks, and landscaping along Livernois. The groundbreaking ceremony was held last month to kick off Phase 1 of the Streetscape Enhancement Project. The university and several partners are providing $1.3 million to revitalize the stretch of Livernois between the Lodge Freeway and 8 Mile Road. Here to talk about that project and other university programs is the president of University of Detroit Mercy, Dr. Antoine Garibaldi. Welcome back to American Black Journal.
Thank you, Steve.
Always good to see you.
Good to see you.
I want to start with a discussion just about your impressions of Detroit. The last time I had you here, you were new. You were new to the campus. You were new to the city. We talked a little bit about the connections you have to Detroit. You have a lot of family here, I know that. But I'm curious. I'm always curious with people who've just come here. What do you think of this? What do you think of this place?
Well, it's been a really great move, and we've really been happy with all the things that are going on here.
Yeah.
There are certainly lots of things to do, whether we're talking about working with the city or education and lots of other areas as well, too. So one of the things that has happened is that people were very quick to get me involved, and I definitely wanted to be involved.
Yeah.
And so there are lots of different
There's
organizations.
a lot of work to do around here,
lot of organizations. And of course, it came at a very good time from my standpoint, with the city really being on the rebound. And over the last 3 years, a lot of things have happened, and I'm very pleased that the university has been very actively engaged in that.
Yeah, and you came here from New Orleans, another city that has experienced some real lows and is trying to get back to a higher point. How do you feel like the two places compare?
Well, the two places are very similar. Even though it's been about 19 years since I've been in New Orleans, and had some stops along the way in Washington, D.C., and also in Erie, Pennsylvania. A lot of the issues, whether it's dealing with education, issues related to crime, also rebuilding the city and trying to connect with more businesses and the like, very similar.
That's similar.
Right.
You would see the same thing in New Orleans.
Right. So I tell people now next year will be 10 years since Hurricane Katrina in New Orleans.
Right.
Certainly, Detroit has been looking at what has happened in New Orleans since 2005, and vice versa.
Right.
New Orleans is looking at Detroit to see how we can improve things, and the recent hire, for example, of the DEGC director, Rod
from New Orleans,
Rod Miller from New Orleans also, is one of those things where you can transfer a lot of the same kinds of things that you did in one city into another one. So I consider it just an urban environment where there's certainly a lot to do, and where there's a great support from the metropolitan area as well.
Yeah. All right, so let's talk about the university's work along that Livernois stretch. When I was a kid, and certainly before that, that was one of the most dynamic commercial areas of the city, the Avenue of Fashion, I believe it was called. For some time, it really did hit a low point in the last 20 or so years. I was just over there the other week on a weekend with my kids, going to a new bookstore over there, and I was surprised by how much has changed, and you can tell that the university is starting to really find its footing in playing that role.
Sure. Well, our School of Architecture and the Detroit Collaborative Design Center has certainly been a big part of that over the last 6 or 7 years, and with great support from the Kresge Foundation and also the Ford Foundation, they've been able to do a lot of things that you really need financial resources to do. So a lot of that focus when I arrived in 2011 was placed between 6 Mile and 8 Mile. Our interest was to try to expand that from the Lodge Freeway to 6 Mile, which is one of the reasons for the Livernois Streetscape Enhancement Project, which is largely funded through a $1 million grant from MDOT through the Detroit Economic Growth Corporation, and then support from the university and also the Kresge Foundation and some other partners. So the intent is really to increase not just the opportunities for commercial development along the entire strip, but it's also to solidify and to stabilize a lot of the great housing and residential areas around the neighborhood.
Right. And for people who are not familiar, I mean, you've got the sort of golf course neighborhood along 6 Mile. You have University District, which is north of 6 Mile, and Sherwood Forest and Palmer Woods are around there, Green Acres. Those were always very stable areas of the city, middle class areas of the city that got hit pretty hard and are trying to come back too.
And two other critical areas are Martin Park, and Pilgrim Village. So I'll be meeting with the groups of individuals from that board very soon. But they have been a part of it, and certainly they support some of the things that we want to do, but we know we can't do it alone. So the Fitzgerald neighborhood, previously called Fitzgerald, now called University, the core, very, very important areas, and because they are right in the middle of us and Marygrove College, that's an area that we really would like to see come back in the way that it was in the 50s. So getting all of the partners together, and then getting University Commons as well, and getting some support from some of the other community organizations, certainly the police force as well. Those are going to be very, very critical in stabilizing the neighborhood. And for our students and our faculty, many of them live in the nearby neighborhood.
Area,
And we'd like to see that as an opportunity for us to really be able to populate that with even more students and faculty. So they appreciate the opportunity to be able to do service work in the neighborhood and throughout the city. But that's really the role of an urban university and the role of any university, quite frankly.
Right. And I feel like all of the universities in the city and colleges are starting to rethink what their role can be in the city. You mentioned Marygrove, Wayne as well is really looking at, okay, what can we do to sort of have an impact on the area around us that maybe is not our campus, but is part of our community.
Right. Well, that's one of the strong points, I think, of the universities in Detroit, because Wayne State, Marygrove, also Wayne County Community College, ourselves, we've been talking and also developing plans, not just for partnerships, but even ways to improve the educational attainment of a lot of our students in the area too. So that has been really good, and it's always great if you can get 4 presidents down and say, look, we want to do this together, because we know one of us alone cannot do it.
Right. And at U of D, U of D Mercy, you have sort of involvement across disciplines, right? There's lots and lots of different parts of the university that are participating in that.
Well, we have 7 schools and colleges, and at the McNichols campus, we have all of the colleges with the exception of the law school and the dental school, which are in other locations downtown, the Riverfront campus, and then the dental school, which is over in Corktown. But on McNichols, we have a lot of the undergraduate and the graduate students, and so they're able to really get very, very involved in things that are citywide. And the nice thing for us too is that our students in the law school and our dental students as well get involved in activities that might relate to some of the other colleges, whether it's architecture or liberal arts and education or business, our College of Health Professions as well, and very definitely our College of Engineering and Science.
Right. The streetscaping, that's a big sort of sign, right? I mean, it's an outward sign that things are different. It's a more welcoming place, and stretching that from the lodge to 8 Mile is really important to you guys because you front onto Livernois
Right.
there.
Well, this particular project is phase one, and I can't thank enough the work of the Kresge Foundation and the Detroit Economic Growth Corporation for helping to put this together, because I certainly couldn't do it alone, and none of the individuals at the university could. But there are actually 5 phases to it, so there are a lot of other things that need to be done along that strip. But I felt pretty strongly coming here that I was getting off at the lodge every day when I was living downtown initially, and said this is really the gateway to the Avenue of Fashion. And some of the things that I saw really were not as appealing. So, like many neighborhoods, and we can talk about Philadelphia when the University of Pennsylvania got involved in some of those activities as well. Once that started to change, people thought very, very differently about the neighborhood. It was also great for the residents in the neighborhood as well. And we think that that's going to spur some economic development, and we also think that it might spur some additional residential development going forward.
Yeah, and that benefit, accrues not just to the university, but to that whole neighborhood. The people who live there, the businesses that are there, they get something out of things looking better.
Absolutely, and it's a start. I mean, the mayor certainly has been very, very supportive of a lot of the work. He's working very closely with the Mayor Grove College area as well. There are lots of neighborhoods around town that could benefit from a lot of that support too. So one of the things that we thought we could do by getting started with MDOT is begin to try to identify some other philanthropic agencies as well as some of the federal agencies that might be able to provide some financial support. So it's going to be a continuous project for the next 5 years.
Yeah. I also understand that there are new opportunities at the college for kids in Catholic schools, is that right?
That's right. We have a new Catholic education grant, and that Catholic education grant will be for students who have gone to Catholic schools from first grade or kindergarten through 12th grade. Be $20,000, 5 year, $5,000 a year if you graduated through those 12 years and went to Catholic schools. And then if you went to a Catholic high school, that will be $2,500 a year, so for a total of $10,000 over 4 years. It's intended to certainly help the Archdiocese with its increase in the numbers of students in many of the elementary and secondary schools. Unfortunately, there are only 3 Catholic schools, elementary schools left in town, and across the street is Jesu, which is certainly has historically been one of the outstanding schools, but there are others as well. And we just think that we know that there are lots of students who are interested in the academic programs that we have at the university, and we think that that will help them. In addition to that, students will also be able to use scholarship grants, academic grants, for those particular purposes. And I just want to say that we've been doing a lot of work also with a lot of the public schools in the area, certainly Detroit Public Schools, some of the schools in the EAA, and also Utica, Oak Park, and many others in Macomb as well. So there are some great scholarship opportunities.
And work, you mean when you're working with these schools?
Well, it's collaborative activities, working with the superintendents, and then making sure that students are aware of some of the
opportunities. Right.
So we have lots of field days. A lot of times when students will come, we've invited lots of the counselors from the area, because 80% of our students are from the state of Michigan.
From here,
So we want to increase that number even more too. So we use 4 messages. We say great academics, great values, great Jesuit and mercy values in a great American city, and we produce great outcomes. So that's why they're coming.
Yeah, well, great work, and welcome back.
Yeah, well, thank
we'll
you.
see you again,
Great to be back. Thanks so much.
Just ahead on American Black Journal, how is the Affordable Care Act impacting health care, especially for minorities? We'll explore that question right after this look at some important moments in Detroit's Black history.
I'm Ken Coleman with a look back at African American life in Detroit. This week in 1936, Roy Lightfoot was sworn in as mayor of Paradise Valley, the popular black entertainment district. In 2001, the Underground Railroad Memorial, created by sculptor Ed Dwight, was dedicated at Hart Plaza. And in 1958, noted author, professor, and activist Michael Eric Dyson was born. These are significant events this week in Detroit's Black history, taken from the book On This Day, African American Life in Detroit.
This past week, the National Association of Health Services Executives convened in Detroit for its 29th annual conference. The nonprofit organization is made up of black healthcare administrators from around the country. Their goal is to promote the development of African American healthcare managers and to improve the quality of healthcare for minorities and underserved communities. Joining me now is the past president of the association's Detroit chapter, Patricia Adams, who's the CEO of Select Specialty Hospital in Flint. Thanks for being here.
Yeah, thank you for having me.
Absolutely. So explain something about this organization's makeup and mission. I'm not sure most people are familiar with it.
Well, NACE,
NACE.
also known as the National Association of Health Service Executives. It was founded in 1968, so it's actually 46 years old. You've mentioned a little bit about the core mission of the organization, which in its infancy and starting phase, or when it actually started, was to promote the advancement of leaders of color in the healthcare industry.
Right.
That is still an area of opportunity for us here today.
I love how you put that, an area of opportunity,
yes,
right?
so the relevance of the organization still exists.
Yeah.
That's the core mission. We have partners as we have evolved throughout, I'll just say across all nationalities, and we welcome anyone into the organization, but that is absolutely our core mission.
Yeah, yeah. So healthcare is a really booming business, and costs are the things that are growing. So what's the backdrop of that change for African Americans and other minorities?
I would say that one of the things that the backdrop for minorities and others, it's about the costs, but it's also about the changing climate of healthcare, as well as the change in our demographic and population. You hear a lot of statistics about how the population of our country has changed.
Yeah.
As our population shifts from one extreme to potentially another, and as it becomes more and more diverse, the need and necessity more so for more diverse leadership to help drive and direct the care for those diverse populations is increasingly needed. And so I think that that's one of the real backdrops. As you talk about costs, as you talk about the change in climate, it's really about being able to increase diverse leaderships throughout the organizations. I was listening to some statistics actually day before yesterday, or during our conference, I would say. And one of the things that they mentioned is that leaders of color make about approximately 12% of all leaders in healthcare across the nation.
Is that right?
And so when you start to speak about statistics like that, as you look at the population that's increasing, we have I'll just say an area of opportunity. I'll use that term again.
It's an imbalance, right?
Yeah, there's a little bit of an imbalance. So it's absolutely critical, and that's one of the focuses of NACE. NACE creates, as an organization, creates a forum where you have, we're attempting to grow, nurture, and develop leaders of color and give them an outlet and access to other leaders of color that have progressed throughout their careers. And it's you know, it's almost like each one teach one, I guess I would say. So.
Right. You know, this is all a very familiar topic to me because I'm the son of a healthcare administrator. My mom was director of nursing at a small hospital here in Detroit for a long time, and I can remember her talking in the 70s and 80s about opportunity and the need for more opportunity. She was the first African American in her post at her hospital, and that was sort of going on in lots of different places.
Yes, and it's still an area of opportunity. It still exists.
It's better.
And
it's better now. I mean, I seem to see lots more administrators. You know, you go to the DMC now. There are African Americans leading the hospitals there, and that was not true when my mom was working in
Yes.
the 70s and 80s.
Yes, that's absolutely certain.
Yeah. How does the Affordable Care Act change the picture for this, or does it?
I think that it does, absolutely, because what it's done is create greater access. So there are people in the communities that we all serve that did not previously have direct access. Everyone has always had access to the emergency room and have historically used that in times as their primary care or primary point of access.
Right.
However, what the Affordable Care Act does is creates access in the appropriate place. So it's almost like right time, right place. So they have access to providers. They can go to seek primary care that will help hopefully prevent an emergency room visit, which is what we all want. So in looking at that, that's one of the things that the Affordable Care Act does, because it increases access for all.
Yeah. Is the opportunity to increase more the number of African American administrators and executives, is this still a question of just of people identifying that, hey, I could do that at an early enough age, and thinking that way? I mean, I feel like in so many fields, there's still that barrier that people just don't think, hey, that's for me.
You know, absolutely. Interestingly, I think that what people do not realize as it relates to health services, and it's one of the things that we've been working on as an organization and creating some partnerships, and recently expanded a partnership with the En-ROADS organization, is that we're trying to get to people at a younger age so they can acknowledge or understand that although they may want to be an attorney, an accountant, or whatever that is, that there are places and roles for those professions within healthcare.
Within healthcare, sure.
Yes,
right.
Business administration, health service administration, and being aware that those are absolute viable careers and that they're actually needed in healthcare.
Right.
Yes.
Right. What were some of the highlights of the Detroit conference that just wrapped up?
Oh, there's so many. Our conference is always so awesome, but as you know, our theme this year was transformation leadership. Be the change, so from volume to value, be the change. And I think one of the things that was really stressed is that we as leaders have to actually be the change that we want to see. So sometimes that may mean stepping a little bit outside the box and pushing for that change that you want to see. So that's one. We had some great guest speakers that came in. The 3 doctors were with us and did a great presentation. A few other presentations. One of the things that I really enjoyed was we talked both to our mid-careers and to our senior leaders about what are the characteristics of the leaders of the future as it relates to healthcare.
Okay,
so,
that's an interesting question.
So historically, you may have thought of leaders in healthcare, and you mentioned your mom was a nurse director or director of nursing, is that you would look more at the technical skills. So you had to have certain experiences, certain technical skills in order to be a leader in healthcare. Well, what's now really what's needed as things are evolving and changing are more actually the softer skills. So it's some of those things that you can't actually teach.
Right.
You have to, you can grow them, you can inherently have them, but it's some of those other skills that will really set the next leaders of the next generation apart from others.
Wow.
Yeah.
Wow. And so how do you reach people with those with the development of those skills? That's
I think
different.
it's starting early.
Yeah.
It's starting early, having them to understand that. Understanding and being in tune to how you treat people and how you understand and being active listeners and some of the other characteristics, that it's not simply about being able to perform and do a job. It's really more about understanding who it is that you serve and being more of a servant leader and being self-aware, because we all know what our strengths are and what our weaknesses are or opportunities are. And I think as you become more self-aware, that will help to enhance that and helping to increase the message around having self-awareness as well as being aware of what, not necessarily what you think people need, but what do people think they need.
Well, and you know, that's those are skills you need in any industry, right?
Absolutely.
I mean, it's not just in healthcare.
It's not just in healthcare, but I would say that those are items that other industry other industries, have historically focused on and
have looked at
acknowledged.
more, I see.
However, it's an evolution for healthcare, whereas healthcare is historically focused more on the technical skills versus some of the skills that the other industries have focused on. So we're getting there.
Yeah, yeah. We've got about a minute left. I'm curious, what do doctors feel, or how do they feel about health reform? I mean, we hear a lot of things about that, but you're sort of on the inside of this. What are they telling you?
Well, I would say that you get mixed stories.
Yeah.
So there are some that are very pleased with the fact that there's increased access,
yes,
and that you're not seeing people walk in who could have been things that could have been prevented,
right,
but because they did not have access to a primary care provider,
now it's an
now it's in, it's an emergent situation,
yeah,
or they're at stage 4 versus this could have been seen, at stage 1 where it was, treatable, and now
right,
there is not a treatment. So you have that element of it. So that's some of the positive.
Yeah.
You have others that are concerned that although there's increased access, that there's not enough providers to provide the access.
Right.
So you have access, but then you also have access constraints.
You're creating demand.
Exactly.
And there's not maybe enough infrastructure to service
Absolutely.
it.
So
yeah,
that's one aspect. And then you have those that says, okay, you've created this access, and for the population, however, the reimbursement associated with the access is not enough to sustain the business.
Yeah.
So, or now I would say sustain the business, because healthcare, we mentioned, it is a business, although our business is caring for patients.
Yeah. Okay. Well, thank you very much for being here.
Oh, and thank you very
much. Congrats on your conference.
Oh,
yeah,
thank you very much.
Absolutely. That's our program for today. Thanks for watching. You can get more information about our guests at AmericanBlackJournal.org. And as always, you can connect with us on Facebook and on Twitter. Plus, you can now hear episodes of American Black Journal on the radio. Tune in to WDET 1019 FM on Fridays at 9:30 a.m. and 7:30 p.m. We'll see you next time.
At DTE Energy, we believe that we have a greater responsibility. We believe that being part of a community means being involved in the fabric of that community, investing time, effort, and resources in the communities we serve. DTE Energy Foundation is a proud sponsor of American Black Journal.